Okay, so to continue on, we're going to talk about hypothermia and cold weather injuries now. Definition of hypothermia: temperature under 95 degrees Fahrenheit or 35 Celsius. The most important thing is to prevent. So there are recommendations on how to layer your clothing correctly to prevent hypothermia, also to prevent heat injuries, which can happen in cold weather if you wear too much protective clothing. Some people at risk for hypothermia are on certain medications or have certain underlying medical conditions. So take a look at those. Of note, I have included all this information in handouts. So if you guys have further questions, what I'm doing in this PowerPoint is really highlighting key concepts. So please go ahead and read the rest of the slides. And if you have any questions, let me know. All right, moving on. So staging hypothermia, you have stages 1 through 4. You have the definitions of each of those stages and how they will present, and then the treatment that is recommended for each of those stages. Basically, anything beyond a stage 1, which is very mild, you want to evacuate them for further monitoring and management. Notice cardiac monitors starting at stage 2. Diagnosis. So rectal temperatures, as opposed to something that we absolutely need to diagnose heat stroke, is not technically good for cold injuries, mostly because you're exposing them more to have to obtain that core temperature. So having a thermometer capable of low temperature readings is more important. And then after that, treatment kind of just reiterated some things there. So go ahead and read that. Frost nip and frostbite. So this is another type of cold injury. Now we're talking about tissue injury from freezing temperatures. Okay, so frost nip and frostbite differentiated by the extent of injury and symptoms. And so go ahead and take a look at those. So we used to grade frostbite using this table and these definitions. However, the problem with this is, as you can see, sometimes you have to wait weeks for the exact grade of frostbite to present itself. And that is not necessarily the best way to do it if you only have 24, 48 hours in the field before determining, hey, like, what does the soldier need, evac or not, right? So here's a grading system that is used for immediately after rewarming, and it kind of gives you a better idea of their prognosis and what kind of care they're going to need. So in here, instead of having treatment in this column, what they have is prognosis, which just talks about like, hey, are they going to need amputation or not? But I think it's important to show that basically at grade 2 or above, you want to evac them because their risk of amputation or needing to amputate the limb is higher. Treatment-wise, though, I would still go with this. It is still appropriate. Okay, so just kind of reiterating this. If it is a freezing injury, you want to rewarm wet, so with water, and do not rub, or you can further injure the tissue. So take a look at those. Now, a non-freezing cold injury, by definition, is injuries that occur in non-freezing temperatures. So there's no actual ice crystals forming in the tissues. You're not having tissue loss because of freezing temperatures, okay? So the first one of these is immersion foot, also known as trench foot. And there have been cases of this occurring in temperatures as high as 60 degrees, but there must be some sort of wet conditions. It must not be freezing, and you can have a lot of these following symptoms. So things like pale skin, numbness, tingling, pain, swelling. Now, the key to a immersion or trench foot injury treatment is to warm dry because it is a wet injury, as opposed to freezing injuries are considered dry. So you want to rewarm in a wet manner. Make sense? So opposites. And then at the last bullet point is about a medication that PA or docs can use to treat for pain control. Hernial chilblains is another type of non-freezing injury. You get inflammation, so it'll show, it can be hard to differentiate sometimes from frostbite because you do have a lot of skin changes, you can get blisters, but remember once again, the temperature was not freezing in this situation. These lesions can last a really long time, so it's important to have them follow up with a PA or doc to make sure they're not having persistent symptoms or that their symptoms are being controlled. So my reference is this came from an American Family Physicians article, and it was actually written by one of the brigade surgeons here. So pretty cool. That is all I got. Thank you.